Well, welcome back, future nurses, to another episode of Med Monday. So let's get started. Today, we're going to be talking about vancomycin. It's an anti infective and it can be given PO, orally, or IV. It inhibits bacterial cell wall synthesis, it blocks glycopeptides, and the indication for this medication is C. diff, MRSA, streptococcal infections, and enterococcal infections. Contraindications include hypersensitivity, so any type of allergic response to that, pregnancy and breastfeeding, renal disease, and in patients with renal disease, we do give vancomycin. However, we monitor the dose very closely and we monitor renal function very closely. Geriatric patients, again, with the renal function, so we monitor the peak and the trough very closely with our geriatric patients, as well as their renal function. Side effects, which are non-life threatening, include ototoxicity or tinnitus. It can increase the BUN and creatinine, so that's why we will be monitoring our renal function. It can cause nausea, vomiting, and diarrhea. Pertitis and urticaria, and adverse reactions, which these could be potentially life-threatening, include anaphylaxis or superinfection, pseudomembranous colitis, nephrotoxicity, so toxic to the kidneys, fatal uremia, leukopenia, eosinophilia, and neutropenia, and necrosis or red man syndrome. If you do subscribe to Med Monday and receive the weekly emails, you will be getting some information on red man syndrome. So nursing considerations include monitoring peak and trough, and these are labs that need to be drawn. We're going to look at our CBC, our liver function test, renal panel, specifically looking at the BUN and creatinine. We want to watch for our blood pressure drop suddenly because it may indicate the onset of red man syndrome. We want to evaluate the therapeutic response, so we want to make sure that it's working, that our patients' infections are getting better. We want to monitor for nephrotoxicity. So again, we'll be looking at our renal function panel. We'll be looking at urine output, urine color, and we want to monitor for ototoxicity and lactic acidosis with metformin. So we need to be aware of that interaction. Patient teaching includes making sure that our patients take this medication as prescribed and complete the course of the medication. We want them to report a sore throat, fever, because it may be a sign of a superinfection. We want them to notify the physician if they become pregnant. We want to teach them the signs and symptoms of anaphylaxis and to report hematuria and oliguria and to report watery, bloody stools, abdominal cramping, nausea, and dehydration, because that could mean that there is another infection on top of it, or it could be part of a reaction. So we do have our weekly challenge question, and you guys are doing phenomenal. You guys are getting it every week. And so I added a little something extra in this one, so to try to make it a little more tough. So here we go. So your physician orders vancomycin 1 gram in 500 mLs of NS IV BID. The infusion is to run over 4 hours. How many milligrams per hour will be infused? And how many mLs per hour will be infused? Remember to leave your answer in the comments to be entered to win a $25 Amazon gift card, and the winner will be announced next week. So I hope you have a great week and keep working on your dream.